See, today I'm going to talk to you about one of the common complications in pregnancy. Now, that is pregnancy-induced hypertension, or sometimes we also refer this as toxemia of pregnancy. Now, as the name suggests, this particular hypertension occurs only during the pregnancy. Now, there are two types of patients with hypertension that we encounter in pregnancy. One is those who are already hypertensive. They know that they've got high blood pressure, they are already on a medication and they become pregnant. Now, this set of patients normally they do well during pregnancy, but a small percentage can have superadded toxemia. For these particular patients, only thing is we have to readjust the medicines of blood pressure what they are taking, because some of the medications of high blood pressure cannot be given during pregnancy. So we change the medication as a result so that they can continue during the pregnancy, and we keep these particular patients on a close follow-up. The second group of patients which I am going to talk to you all about is what we call it as a toxemia of pregnancy or pregnancy-induced hypertension. Now, these patients are absolutely healthy when they conceive. They don't have any kind of a problem, but during the course of their pregnancy, they show the symptoms and they develop little high blood pressure. Now, if there is only high blood pressure, we call it as a pregnancy-induced hypertension. But in case they develop some super added problems like swelling of the feet or albumin in the urine, then we call the same condition as a toxemia of pregnancy. Now, this hypertension, which occurs only during the pregnancy, actually it is a disease of the placenta. As all of you know, the placenta is that particular organ which is attached to the mother in the uterus, and through this the fetus gets all the blood supply. So somehow, due to some reason, this placenta starts producing some kind of toxic products which causes the chain of events, and one of them is high blood pressure. So that is why we call this condition as pregnancy-induced hypertension. And once this hypertension develops, it settles only after the delivery. And after the delivery, after about 3 weeks or 4 weeks, probably the patient may require medication and it settles down and does not leave any long-term effect on the mother. Now, every patient does not develop this complication. About 15% of all the pregnancies have this kind of a complication, what we call it as a pregnancy-induced hypertension, or they go into a toxemia of pregnancy. Since every patient does not develop this, then what are the risk factors? Who are those patients who are likely to have this kind of a problem? Number one is the age of the patient. Very young patients like teenage pregnancies who get pregnant at the age of 16, 18, less than 20, they are at a very high risk of developing toxemia of pregnancy or pregnancy-induced hypertension. Then at the other spectrum, those patients who conceive after the age of 35 again are at risk of developing pregnancy-induced hypertension. So both the extremes, at a very young age and at an elderly age, both are at risk of developing high blood pressure. Second is, it is more common in a primigravida, means those who are pregnant for the first time, maybe whatever the age it may be, as compared to a multi. Multi means those who have already become pregnant and have delivered. The people who, or the patients who become pregnant for the first time are at a higher risk as compared to the multigravidas. Then there are certain conditions in pregnancy. For example, multiple pregnancy. Patients who are carrying twin pregnancy. Again, they are at higher risk of developing this kind of a complication. Besides that, if a patient has got pre-existing medical problems. Now, what are those problems? As I said earlier, the person who has been hypertensive, she has been on a medication. Now, in the course of pregnancy, she may not have any problem, but she can develop superadded toxemia, means she may develop swelling of the feet and other complications associated with it. Patients with kidney diseases, chronic kidney problem are at a very high risk of developing toxemia. Patients with autoimmune disease, for example, patient with SLE, again, they have other targeted organs which are affected like kidney, so they are also at a risk of developing toxemia of pregnancy. Diabetics and obese patients. Now, these are the ones who are at risk of developing high blood pressure during the pregnancy. Now, there is a peculiar type of pregnancy, what we call it as a molar pregnancy, where the fetus does not form, but the whole of placenta gets converted into a fetus like bunch of grape. Again, it produces lots of toxins, and the patients can have very high blood pressure and toxemia of pregnancy. Now, when does it start? Actually, the patient with toxemia of pregnancy or PIH, it does not occur before 20 weeks of pregnancy. Normally, it occurs after 20 weeks of pregnancy, and invariably in the third trimester, that is, once they cross the 28 weeks of pregnancy, that is the time when we normally note that they are developing high blood pressure and other features. Now, what are the symptoms? It's very peculiar. The patient who is coming for the regular antenatal checkup, she may have no complaints at all. But when we check the blood pressure, it is higher than what it was earlier. And the cutoff level what we take is 140 by 90, means 140 systolic and 90 as a diastolic. So if they cross this particular, we are at, as an obstetrician, we are always on guard. Well, this particular patient probably is going into a toxemia, and they kept under close observation. Sometimes the patient may come with a headache. They may come and complain to us that they've got a swelling of the feet, or they may say that they are passing less amount of urine. So all these symptoms, if they are associated with high blood pressure, well, we as an obstetrician are very much on guard, because this condition can lead to complications both to the mother and to the child. Now, finally, how do we diagnose? What do we label as toxemia? Now, pregnancy-induced hypertension is the one when the blood pressure is raised. But on top of it, if they develop swelling of the feet and there are proteins or albumin in the urine, we immediately shift this terminology to toxemia of pregnancy. It is a little higher grade of the hypertension, which has got more complication as compared to only the hypertension. Now, why are we so worried about it? What complications it can lead? Now, the complication, this particular toxemia does not confine itself only to the blood pressure. The only thing what we can see and diagnose is a high blood pressure. But silently, it can affect the other organs. And in case it is not treated, it can affect the liver, it can affect the blood, that is a platelet, it can affect the kidney, and if the blood pressure goes very high, the mother can develop fits, mother can have blindness. So there are lots of complications which the mother can have in case she develops toxemia of pregnancy. Now, the blood pressure steadily rises, and the patient, as I said, her liver function test can get deranged, her platelets can decrease, and the patient can throw fits if it is not treated properly. And if she develops fits or her the biochemical parameters get deranged, now we label this patient from a mild toxemia of pregnancy to a severe toxemia of pregnancy. Does it affect the fetus also? Yes, of course. It also, since it's affecting the mother, it also affects the fetus. Now, if the blood pressure is high, the growth of the baby inside the uterus becomes retarded. So the baby is small and it does not grow properly. The blood supply to the fetus gets affected. Secondly, it can suddenly cause a abruption of the placenta, means placenta which is attached to the wall of the uterus inside can separate and the patient can have severe bleeding and can lead to intrauterine death of the fetus. Now, how do we treat this condition? Now, number one is early diagnosis. Now, that is possible only if the patient comes for a regular antenatal checkup. So, the importance of antenatal checkup is the only one where we can diagnose this kind of a condition. We have seen patients who don't come for the checkup at all and suddenly they come with a high blood pressure, they come with fits, all these things. So the first is the prevention, and that is a regular antenatal checkup of the patient. Once it is diagnosed, then we do all the biochemical tests of the patients. We do the liver function test, we see the albumin in the urine, we see the biochemical, like we see the hemoglobin, and we see the platelets of the patient. And then the treatment. Actual treatment is delivery of the patient. That is the permanent treatment. Now, if the patient is early in pregnancy, means she's only about 32 weeks, so we want to tide over the crisis of delivering a premature baby. So we treat this patient with a medication to bring down the blood pressure and keep the patient under close observation so that her blood pressure is maintained and she does not land up with the multi-organ effect on this thing, or effect on the liver, enzymes, or effect on the platelets. So aim is to avoid complications and timely delivery. Now we cannot ensure that this particular patient can carry on the pregnancy till the term be 38 weeks or 40 weeks at all. But what we want is that this particular patient, when she develops toxemia, we try to take up the patient till we can deliver the patient where the baby will be in a good, healthy condition. So that is our whole aim of a management of a toxemia of pregnancy. So what advice I will give to my patients, all those in case somebody is listening? Number one, regular antenatal checkup. Please don't ignore. See, many people I've heard or the patients say, okay, we go there, they check the blood pressure then. But in case we don't check the blood pressure or we check the blood pressure found to be high, that is the first signal which comes, okay, this patient may be heading for a complications. Number two, do not ignore any symptoms. Suppose you have seen the doctor and at that time your blood pressure was normal or it was slightly on the higher side. Do not ignore the symptoms if you are passing less amount of urine. Do not ignore the symptom if you are having pain in the abdomen, in the epigastrium. Don't pop off taking a antacid tablet thinking that you got a gastritis. Please go and consult your doctor because this may be the first signal that you are heading for a complication. Do not ignore if you have got headache, and do not ignore if you are finding difficulty in seeing, or you feel that your eyesight is becoming hazy. Immediately go and check on your doctor and see. Let the doctor decide what is to be done. Besides this, any other unusual symptom. Suppose the patient who has been diagnosed as a case of toxemia of pregnancy and starts bleeding, it is not normal. Immediately you should go, or if you are not able to feel the movements of the baby, you should again go and consult your doctor. So my advice is regular antenatal checkup. Do not ignore any abnormal symptoms if you have got, or any unusual symptom, and follow your doctor's advice. Invariably we see that patient take advice of the doctor and then go and consult on the internet and the Google. Yes, it's very good because we have got so much of information which is available, but information is available. Interpretation is yours. So many people misinterpret all this advice what is given on the Google and they land up with the complication. We as an obstetrician are your friends. We will advise you correctly And we want you to have a comfortable, safe pregnancy and a safe delivery so that you go home in a good, healthy condition with your healthy baby. And this is my advice to all of you. Thank you.